Hello, I'm Dr. Dennis McKenna giving you another Albany Med update. Today is Monday, November 10th, and I'm joined today by Mr. John DiPaola. John, great to have you here.
Great to be here, Dr. McKenna.
John is our Senior Vice President for Diagnostic and Therapeutic Services. We're going to talk about that in a moment. All right, let's jump in. So tomorrow is Veterans Day, right? 11th hour, 11th day, the 11th month, the end of World War I. We would like if you'd like to join us to visit some of our patients in the hospital who happen to be veterans. We run a list every year, and a small but mighty group of us go out and we put flags on their bedside tables or thank them for their service. And there's still an opportunity, if you'd like to join us, to reach out to Kelly Marone in the volunteer office, and we'd love to have you join us tomorrow when we do that. In addition to that, I think, John, you would join me in thanking all members of our workforce who are veterans, so we thank them for that as well. Another thing that's happening this week is open enrollment. That's been the case for the last week or so. We encourage you, please, if you haven't gotten that done, put the time aside and let's get that done. That's important. That's about making sure that we have all of our benefits set for next year. I also want to thank our Human Resources Department and our finance team and those who work on our benefits package to make sure that we're ready to do that every year. But we also want to encourage you to get that done.
Yeah, and great benefits fair session this year, Dennis. I actually had a chance to attend, and like you said, our Human Resources does an excellent job in pulling that together and keeping our staff members informed of their benefit choices.
Absolutely. All right, let's switch over to some clinical things here. John, one area that we'd like to talk about is recently in our electronic medical record, Epic, we went live with a new module for when we need to do a massive transfusion protocol. These would be patients who come in who often after trauma need a significant amount of blood products as a stabilization or maybe a life-saving measure. This is complex, right? This requires a lot of work with a blood bank, laboratory, pathology, trauma team, emergency physicians. We don't take this lightly, and in order to move it from a paper process to electronic process is something that we want to call out.
Yeah, and Dennis, you know this better than most, being an emergency medicine physician. Life-threatening situation, very stressful, very intense, and really the team that helped develop this process in Epic, you know, sort of across not only clinical providers, but also our informatics and IT folks did a wonderful job collaborating across the whole entire system. So all 4 affiliate hospitals were involved.
That's right.
Different needs when it comes to mass transfusion protocol, but all came together to come up with a process that works for all 4 hospitals. So just a great accomplishment by the team.
And it has been used since it's been built. And I understand it's been used, and it was used very safely and efficiently and effectively. So that's obviously proof that the work produce a product that is going to hopefully help us save lives.
Yes, and from a diagnostic and therapeutic services standpoint, I spoke with Dr. Subik earlier today. She echoed what you said. Very impressed by the process. It's working very, very well, and significant efficiencies based on the old manual paper process to what we have now put in place at Epic.
In the category of new and exciting things like our massive transfusion protocol, I would include the Logistics Center, which had its official opening last week. This is the newest iteration of what we used to refer to as the Transfer Center or the Access Center. This is a recognition that now the coordination of patients is not only from outside hospitals in, but also the movement of patients in the hospital, bringing into one central locus, obviously, bed access, transportation, environmental services, an EMS liaison working with local ambulance agencies. Too many people to thank, but if you haven't had a chance, go by, check it out. We appreciate the entire facilities team, engineering, who built this incredible space. We thank the visionary role that Dr. Teleski had in imagining how this could work, and obviously everyone who made it happen. So congratulations. And it's the central hub for 17,000 patients every year being transferred into the health system, most of them coming here to Albany Med. Let's talk about a couple areas, John, in your area. So diagnostic and therapeutic services, I know you want to call out some of the growth that's happening in that area.
Yeah, really, Dennis. Patient access is what we're all about, and taking care of patients in our community. And for us in Diagnostic and Therapeutic Services, we want to help physicians and nurses take care of patients. That's the services that we provide. And I'm really proud to say that we continue to grow in 2025. A year to date, if you take a look at our patient volume, and what we have listed there is really over 9 million patient encounters on an annual basis that our 12 departments provide. And again, a really strong growth for this year. We're up 7% in terms of the services that we provide over last year. And I'm really happy to say, and calling it out for this month, is October was our busiest month ever in terms of the services that we're providing. So over 900 staff across all of the DTS departments, just doing incredible work day in, day out, 7 days a week. And our leadership team, a really mature group of leaders. The average tenure that we have for our DTS directors and managers is 22 years of service here at Albany Medical Center. I'm going to call out one name.
Please do.
Nancy Finn has been with us over 40 years
and
does a great job in neurophysiology. So I'm just so proud of the team and so thankful for all of them.
Yeah, absolutely, and of course under your leadership as well. So thank you. And thank you. It is a focus on growth and access, because quite frankly, the services that those individuals provide is often services that are provided nowhere else, right? So thank you for that, and they do it both inpatient and outpatient.
Exactly right, Dennis. Yeah. Exactly right.
Let's talk about some recipients of some awards. We'll do our Daisy Award for this month. So this is Mara Cunningham. She's a nurse on C7 Peds. And John, the family that recognized her wrote some very nice words about her.
Yeah, they called out that Mara was patient, kind, and always quick to help. And I think this one says a lot about Mara as well, that she radiates love and light.
That's nice.
That's wonderful.
Yeah, so congratulations to her. Cinnamon rolls, on their way.
Yeah.
On their way. 2 Eye Care Award winners at this last month's Center Combined Leadership Meeting. Amalia Gill, who's a supervisor in Access Services. She gave a lovely speech, really very heartfelt. And Ahmad Toki, who's an ASA 6 in Physician Building. So a perfect opportunity to recognize 2 individuals who came into this organization, had an opportunity. In the case of Ahmad, he's only been here 1 year.
Yeah.
And what an impact he's already made. But obviously important individuals in our access department who are often the first face that people see, the first voice that they hear coming into often stressful and chaotic environment. And so we appreciate both of them. And they both really had very wonderful things to say.
Very important roles, no doubt about it.
And we'll close it off with a reminder that if you're interested in getting tickets for the Melodies of Christmas, happens every year at Proctor Theater. Benefits go to the Bernard and Millie Duker Children's Hospital, obviously, and our Melodies program at Albany Med, treating childhood cancer and blood disorders. So please, it's a wonderful event, and many of the patients who've come through there perform on stage, raises a lot of money. It's good holiday cheer, Melodies of Christmas. Get your tickets.
Yeah, wonderful, entertaining evening, and no better cause.
Yep, been there a few times myself. Yeah. Yep, all right, John. We appreciate you being here. Anything else that you have for us today?
I think I'm all set, Dennis.
You are all set. We appreciate you and your team. Thanks for joining us today. All right, so as a reminder again, get your open enrollment done. Very important. If you want to join us tomorrow, recognizing some veterans, please do. Everyone out there working very hard, we appreciate you now more than ever. We'll be back in a few weeks. We ask that you once again, please take care of yourself and take care of each other.